Hi, my name is Dr. Matteo Piovella from Italy. I would like to introduce the video Boost That Smile, enhancing the wow factor with small incision lenticule extraction. Smile represents the most important innovation in refractive surgery since 1990. Smile does not adopt excimer laser technology and could not be considered associated to LASIK-related complications that today are the weakest experience that penalize the refractive surgery growth. Smile is different if compared with LASIK and PRK. It is different corneal surgery and needs specific experience to switch from traditional refractive surgery. Every innovation, especially if expensive, faces opposition before adopting it. In 1990, Summit machine treated only 3.5 mm optical zone, while the Vuzix 2020 adopted 6 mm area. With Tetracal, we've developed multi-zone technique treatment that allows to treat safely high myopia. But in the market, Summit Laser sold the highest number of machines. This video production by Dr. Shita Brar adopts Dr. Sri Ganesh concept. It is a milestone in understanding smile treatment to provide the right motivation to adopt it. Different technical innovation, different corneal surgery to achieve best refractive result. Be open-minded to a new effective and efficient world. I hope you enjoyed the video.
It is often said that the biggest room in the world is the room for improvement. This also applies to the field of refractive surgery, which has evolved from the era of keratomileusis to refractive lenticule extraction, popularly known as SMILE, through a process of continuous improvement. Besides a steeper learning curve, a relatively slower visual recovery compared to the wow factor seen in LASIK is one of the important reasons behind the hesitation to adapt SMILE. In this context, it is important to mention that the results of SMILE may vary from surgeon to surgeon and depend upon various factors. In this video, we discuss some simple and practical approaches to potentially enhance the first-day visual results after SMILE, thus improving both the patient and surgeon's satisfaction. Regarding energy optimization, one needs to understand that just like identical twins who look similar but may differ in their behavior, two laser machines of the same brand may also have variation in their performance. While optimizing a laser, two factors must be considered: opaque bubble layer and black spots. OBL formation is mainly considered to occur due to the use of higher energies with closer spot spacing. Hence, to minimize OBL, the use of lower energies has been recommended by several studies which have demonstrated improved visual recovery using lower energies in SMILE. However, if the energy is too low, it can lead to black spots due to gaps or tissue bridges, leading to difficult tissue dissection, and therefore it becomes necessary to reduce the spot distance in order to achieve a smooth cleavage plane. Hence, the process of optimizing the laser is individual, involving a stepwise approach of tweaking the energy and spot spacing. Most of the times, the endpoint of energy optimization is subjective and no clinical sign is described to help a surgeon decide if an ideal bubble pattern has been achieved or not. We hereby describe a simple intraoperative sign called the gas bubble escape sign, which may guide a surgeon optimize their laser setting. In this sign, as the incision is accessed, there is an escape of bubbles followed by an immediate change in the morphology of the interface from opaque to a more translucent one. This sign is observed in an optimized laser pattern, which allows an uninterrupted escape of bubbles, leading to a smooth lenticule dissection and better immediate post-op visual recovery. However, when there is opaque bubble layer or black spots, these areas may entrap the gas bubbles, thus resulting in increased resistance while tissue separation. The gas bubble escape sign may thus be a useful indication of an ideal energy setting and may suggest that no further optimization is required. Conventionally, while performing SMILE, same spot spacing is used for both the superficial and deeper planes. However, considering the fact that the posterior corneal lamellae are thicker and wider than their anterior counterpart, differential spot spacing parameters may be suggested, wherein we aim at delivering a relatively higher energy for the lenticule cut as compared to the cap cut. This can be achieved by reducing the spacing between the two spots by 2 steps or so, which increases the overall energy for the lenticule cut, thus allowing smoother tissue dissection of the same. In our experience of comparing bilateral eyes, where conventional parameters were used in one eye and differential parameters in the contralateral eyes, we found greater ease while separating the deeper plane in the differential spot spacing group, which also showed significantly lower mean objective scatter index values on the first post-op day. This may be a step forward towards optimization of the energy, especially while treating higher degrees of myopia. Currently, the criteria of cone selection is based on the horizontal wide-to-wide diameter of the cornea. However, we recommend universal use of a small cone for treating all corneas irrespective of their diameter. This is because of 2 reasons. First, unlike LASIK, where the flap diameter varies according to the corneal diameter, the cap diameter in SMILE is usually fixed and does not exceed beyond 8 mm, which is feasible even with a small cone. Secondly, a small cone also ensures better fit compared to a medium cone, which leads to a greater mismatch between the cone and the corneal curvature due to its increased sagittal height. To overcome this, a full applanation is required, which leads to excessive corneal compression and OBL formation in the periphery, as can be appreciated in this video. This may affect the ease of dissection and immediate visual results, and the same was verified in a contralateral eye study. Last but not the least, once the laser is optimized, it may be possible to separate the lenticule even without performing any dissection with an advanced technique called lenticuloschisis or no dissection technique. In this technique, a microforceps is used to gently push the lenticule in a circumferential manner, which is then extracted using the same instrument. Since this technique involves minimum tissue manipulation, the interface quality was seen to be smoother compared to the conventional dissection technique, which may also potentially result in faster visual recovery. Hence, by understanding and applying these finer points, one can certainly boost their immediate results with SMILE, thus achieving a wow factor which is as good as or better than LASIK. It may be noteworthy to mention that the concepts discussed in the video may not apply to a small percentage of eyes, as the science of femtolasers is limited by corneal biomechanics. So, customizing the energy based on individual corneal properties would be the ideal way to go about it. And well, that's where we have room for further improvement.